Unfortunately, ovarian cancer is very difficult to treat for two really important reasons. Firstly, it's very difficult to diagnose early, and by the time a woman with ovarian cancer has got symptoms, there's already spread around the tummy, the abdomen. And secondly, it's a very complex disease at the genetic level. The changes within the cancer cells are very complex, and the cancer is very good at adapting and overcoming its sensitivity to treatment. So in other words, patients become resistant to treatment quite quickly.
Well, there are two big sort of exciting developments on the imaging campus. One is the use of artificial intelligence to automate a lot of tumour evaluation in terms of tumour burden, which ultimately leads to far more accurate, quicker assessment of tumour response. And the other really big sort of new development is the use of metabolic imaging, which can give a very quick, accurate readout if the tumour is responsive or not. Really, after one cycle of chemotherapy, this can be done by various PET tracers, but also with carbon-13. So really, does the drug work? Yes or no, and if it doesn't, what is the next drug to use or the next treatment strategy, really?
So integrated cancer medicine is our approach to dealing with very complex diseases like ovarian cancer. So what we're trying to do is to bring together all the things we can measure in a patient, the clinical features, the imaging, the molecular tests, the tumour, at very high scale and resolution in one place. And by studying patients in this very, very detailed way, we think we're going to do a better job of pulling out the complexity of the disease and understanding the patterns when they happen. Well, I think the most exciting thing about new treatments for ovarian cancer has been the development of medicines that patients can take after their initial chemotherapy and surgery, like the PARP inhibitors. These are game-changing in terms of helping to control the disease for longer. And I think the really important thing about this is it tells us that changing treatments and bringing new combinations of treatment around the PARP medicines may actually lead to many more cures than we've seen over the past 20 years.
One of the collaborations that has been very successful and we're very, very, very excited to work with is with the General Electric, and it's really creating a visualization platform. I'm really excited that patients have, on one snapshot, they'll see their disease, they'll see their treatment journey, they'll see their pathway, and that will allow them, together with their treating physician, to actually make much more informed decisions. They'll be really in control of their disease and their choices.
So my vision for ovarian cancer is that we'll break through the barriers that are about trying to choose the best time to have chemotherapy, the best time to have surgery, and that we can now, using the advanced imaging methods that Evis is developing, plus the genomics, work out when a patient will really benefit from treatment. If they aren't going to benefit, switch them to a trial or a new treatment that will benefit them. And at the moment we have no easy way of doing this because of the limitations of all the data sets and trying to bring it together in real time for the individual.
My vision is that we were going to have a much more integrated and intelligent way of tracking the tumour dynamics on the patient throughout their journey, doing that in a very cohesive way from the macroscopic sort of imaging phenotypic part, but also from genomics. So ultimately we deliver that integrated care in a way that we're not able to deliver it today.
I think Cambridge is very well placed. We have an exciting vision with the Cancer Research Hospital, a hospital that uniquely is embedding institutes for research into an NHS hospital. I think that's going to lead to huge benefits for patient care, not just in Cambridge, but also the ability to share those experiences and that know-how outside Cambridge, across the Eastern region, across the world.